Welcome, everyone, to In the Hot Seat. For our repeat viewers, thank you for joining us again. For those who are new to the show, every 2 weeks, we put industry experts or customers in the hot seat for a lively discussion, debate, even some discourse as we humanize the digital experience. All aspects of the customer lifecycle are up for discussion, as well as the technologies used throughout each phase of the journey. Today's episode is the third in our healthcare series, and we are focused on patient experience. And Thomas loves his patient experience, don't you?
No, I can't be patient.
Wrong kind of patient.
Oh, bummer. Bummer. Yeah, well, talking about patient experience, I got a bill the other day, an invoice, actually, on Saturday. Well, I picked it up on Sunday out of the letterbox, but it was for a treatment in, hold tight to your chair, early December 21, which I paid for December 21. And this was not the first invoice of theirs.
That's like 2.5 years. That's crazy.
Yeah, it's quite crazy. So the fun part is, how the heck don't they get their invoicing, their back office in order, especially since I repeatedly called them and told them this was the date the check got cleared. This is the check number. This is the reference number of the transaction. Don't know. Need to call them again, I guess. By the way, they never call back.
Well, when we were talking last week, I mentioned that I had insurance for a while, and then I dropped to one insurance because my husband we're insured through TRICARE because he's military. And so, then I only had TRICARE for a while. Then I had another insurance plan. And I can't tell you the number of times I have had to tell these people how I had no insurance for no other insurance for like a year and a half. And I've told at every level of their customer service organization that I didn't have other insurance. Please pay my bill. You aren't secondary anymore. You have to pay this. And I just got another bill this weekend. I said, I can't wait to tell Thomas on Monday. We were literally just talking about it on Friday.
Can it be that the patient experience is mainly dominated by insurers?
I think that's a large part of it. And I can't wait to hear how that plays out today. But, I know that even beyond bills and insurance, if you don't know the system, it's difficult. 64% agree they wish healthcare providers took more time to understand them. 40% say there are times when they're afraid to speak up during healthcare appointments. I mean, that's a huge part of the experience. So you've kind of got it on the coming in side, and you've got it on the billing on the back end side. And I'm really excited to hear what Shanne has to say about this. So should we go ahead and bring in Shanne?
Yeah, let's bring in one more point before, but no, don't.
So welcome to Shanne Keeney. Shanne grew up mostly in Berwick, Pennsylvania, and went to college at Lock Haven University, where she earned a bachelor's degree in fine arts. She then joined the Marine Corps and spent over 7 years as a flautist with the Marine Corps Band. She attained her master's degree in information systems management from Keller Graduate School of Management, completed additional studies in health informatics at the University of Minnesota. She is currently a student at Drew University, pursuing a doctorate in medical humanities. Shanne has spent most of her post-military career in the health insurance, health and human services, and healthcare industries. Immediately prior to coming to Johns Hopkins, Shanne served as a director of patient and guest experience at Penn State Health Milton S. Hershey Medical Center. In her patient experience roles, she has had oversight to patient experience coaching, volunteer and guest services, patient and family-centered care, language services, and patient relations. So welcome, Shanne.
Wow.
Thank you.
Wow. Okay. So, let's dive directly into it. I mean, you're surely talking a lot of patients as well as providers, but what do you in these talks gets expressed most as the grief that patients have when talking about healthcare and interacting with doctors?
Yeah, I think that probably the most common concern that we hear about in healthcare, it really boils down to communication. So communication is such a huge bucket. It can be any number of things. It's communication with both technology as well as the humans involved in the care. So it could be a cumbersome phone tree where they can't reach a human being, or the lack of response to a voicemail message or an email message or a message through the electronic health record. Maybe not doing our part, or giving the perception that we haven't listened well to the patient or the family, or maybe we haven't explained things well, maybe being rude or dismissive. And then communication can extend to the healthcare team itself as well, right? So maybe I feel like my two different doctors aren't talking to each other. They're not on the same page as far as my care plan goes, or the nurse and the doctor, maybe it feels like they're not communicating. So that communication bucket is really big, and we hear a lot of frustration that really in the end boils down to communication, even when it may be presented as something else. Sometimes there's confusion about the care plan, and potentially impact on the health outcomes because of a lack of communication or a lack of clear communication.
What could be a cause for this?
What could be the cause?
Yeah, for this poor communication.
Yeah, that's a good question. I don't think anyone sets out to be a poor communicator intentionally,
No.
right?
Probably not.
I'm pretty sure that doesn't happen. So I think, a lot of times it is the complexity of the system. Sometimes it's that, healthcare teams do the same work day after day after day. It becomes routine for us, right? We're in the system, we understand what we're saying. It's routine, and we're just not explaining it to somebody who doesn't spend that much time in the system and really doesn't understand it, or, uses language that others don't understand. So I might be, an oncology patient talking to my physician, and I don't understand all of the different differences between radiation and chemo and other types of interventions. And it's a lot of medical jargon, right? So we need to really make sure that we're all speaking the same language and ask questions.
Okay, so apart from breaking up, this sounds like you said routine and always doing the same. This to me sounds like a great use case for automation, for which there have been some studies, some scientific studies actually, that basically concluded that a chatbot is better at exhibiting empathy to the patients than the doctors. Is that a way out?
Wow, I don't think so, and that makes me really sad. But
Which part makes you sad?
well, the part that maybe a chatbot is perceived to be more empathetic than a human being. So I guess I'll say, again, it's safe to say that most people get into healthcare because they truly care for people and they want to help others. So they are extremely compassionate individuals. And they're also human. So maybe at times their words or actions don't demonstrate that compassion that they're feeling inside, whereas a chatbot is programmed to respond, right? And is going to do so consistently. They don't have that human element that's going to make them inconsistent as long as they have the correct inputs. But I will say that those chatbots, they're really, they might give the perception of caring, but I don't think they really have those feelings. They don't really care about you as a human. But I'll have to look up that study because I'm interested. It does make me sad to hear that.
Well, you're right. And chatbots don't have a bad day, right? And they're not running from room to room to room, to patient to patient to patient, worried about their numbers for the day. Yeah. So when it comes to things like chatbots and telehealth and all of that kind of stuff, what other than empathy, but what do you hear as the patient experience with that stuff? Do people who are patients enjoy that, or would they rather talk to a doctor?
Well, I mean, I think with most telehealth, you are still talking to a doctor, right?
Okay.
It's just the mode where you might be on a Zoom, or you're somehow electronically connected with your doctor, whether that's via video or just on telephone. So I think sometimes people do enjoy that. There is a convenience that is there for people. It's easier. You can usually get a doctor 24 hours a day if you're using telehealth. It might not be your doctor or the doctor that you see most frequently, but you can get healthcare. So I think there's a little bit of increased accessibility from a telehealth perspective. But I think I would, really be looking for the same components of patient experience that are incorporated into a live visit as well. So we really are looking for quality of care. So we want to make sure that care is appropriate. It's good. It's safe care. It's timely, and it's delivered with compassion. And that the patient is really a partner with the physician, and contributing to their care and what they expect and what they need, so that we can make sure that we're individualizing that care for them. So I don't think the components of patient experience are different. You just throw that added layer of technology on there, which can sometimes complicate things.
So that's interesting. So when you think of like social determinants of health and socioeconomic data on patients like age, race, status, how do the different demographics perceive and use telehealth services? Like, is it hard for somebody who has a lower socioeconomic status to have access?
So that's a great question. There was a study, I'll say that, prior to COVID, telehealth was a thing, right? But it wasn't a huge thing. And the pandemic really pushed us to find ways to offer care to people in what we perceived to be maybe a more safe environment, right? And sort of help flatten the curve and reduce the spread of COVID. So telehealth really surged to the forefront during the pandemic. I think it's sort of calming down a bit, so to speak. But people are still using it, and they're still interested in using it. There are some studies out there. Now, the most recent I've seen is, I think, from 21 and 22, where it said, I thought had some surprising things in it. At least I thought they were surprising, because telehealth use rates were actually lowest among people who are uninsured. I didn't think that was super surprising, but also the lowest with young adults, age 18 to 24. And I thought that was really interesting, because we often think that our younger generations are so tied to tech, and they're going to jump all over this offering. But the highest rates of telehealth visits were people who were covered under Medicaid and Medicare, and individuals who are Black and earning less than $25,000 a year. But they used the mostly telephone visits and not video telehealth services. And so there are some interesting differences among the different demographics of people who are using telehealth as an option for care.
Okay, that's fascinating, because that's not at all what I would have expected. So that's really interesting. So especially for people who use phone without video, do you think there's a long-term effect on the relationship between the provider and the patient from something like that?
Yeah, I think that really needs to be studied more. But I think, from my personal opinion, I would say that there probably is. I think that we definitely would have to work a lot harder to maintain that patient and physician relationship when we're on any version of telehealth, whether that's a telephone call or a video chat. Because let's be honest, how many times are you on a Zoom call and you're multitasking, right? And so it's easy, even though it's an appointment, it's easy to multitask. And I do remember, sort of at the beginning, or maybe a little bit towards the beginning, middle of the pandemic, that we had to come out with some tips and tricks for patients who are seeking telehealth services. Like, please don't be driving your car. That's not safe. We want you to be in a quiet place where you can focus on the physician. And then, hearing back from our patients as well. Like, I could hear a lot of background noise from wherever my physician was at the time of the appointment. And so I think it's really challenging, and we have to work hard to make sure that we can continue that relationship building.
Okay, the provider being in the car probably points back to to the confidence people may have in the chatbot, the compassion part of it.
Well, I think it was the patient in the car, but yeah, we won't have our physicians in the car either.
Yeah. But what you're saying, that there are some challenges with, well, access and in extension probably also accessibility of telehealth services. What do you think are the shortcomings? So where can providers or technologists, insurers improve most to make these services more accessible, more used, more beneficial?
I think that, it really comes down to knowing our patients and knowing what their challenges are and what their needs are for their care. And again, I don't think that that's much different from an in-person appointment. We need to know those things for those as well. I think there are times when a patient may have a physical disability, for example, where telehealth is really more accessible for them. They don't have to worry about arranging transportation and, maybe having someone to help them get to the appointment because they can have it via telehealth in the comfort of their own home. And there are times when that might be more accessible for family members to join the appointments, so that if you have, or any other caregiver who's, helping with the patient, who maybe can't be in the same room at the same time, but could join a telehealth appointment, say from work for 30 minutes. And so I think that there are some really good benefits to that telehealth, but I think we also need to know, are we effective in communicating with our patients when they're on telehealth? And that's really critical. So do the patients need to have assistive technologies? Do they need closed captioning? What can we do to make sure that we're effectively communicating, which, as we know, is sometimes in person. You're putting that piece of technology or multiple pieces of technology in between us. And so similarly, I would say patients who need interpreters, and especially our patients who are deaf or hard of hearing who use American Sign Language, it's not always appropriate or easy to see. You don't get that depth perception that you might have in person with an interpreter when you're all in the same room together. So I really think it comes down to knowing what our individual patients' needs are. And I think that there are solutions out there, but really cautiously deciding when it is appropriate to have a telehealth appointment and when it's not, and making sure that we have those interventions in place so that we can communicate effectively.
Can you have some examples? Sorry, Kristy.
No, yeah,
You
that's
said some
good.
solutions. What are some good examples?
Hint, he's looking for technology and AI. These guys
Oh,
are
well,
all looking for AI.
Man, I'm a computer scientist.
there's closed captioning is an example. CART services, which I can never remember, it's an acronym, but for people, if you are preparing for someone who maybe has a visual impairment, making sure that you have things that are printed out or can be read by the technology on the phone or on their iPad, whatever device they're using, so it can be easily read to them. So yeah, I think there's technology out there that can help.
That's cool. And so I assume that as you do this process with patients, you continue to get feedback from them that goes into improving the process. How do you see AI playing a role in how this evolves?
Yeah, that'll be really interesting. I'm going to go on a little soapbox first and say that, continuous feedback from our patients is so important. I think, I'm always advocating to include the voice of our patients as frequently as possible, whether that's with, our patient experience surveys after appointments, or our patient and family advisory groups or focus groups. Polling the community and, our consumers, and incorporating their voice into healthcare planning policy committees. So not just waiting until we've done something and then saying, hey, you experienced this, how great was it? Or maybe not great. Tell us about your experience, but saying, hey, we're thinking about doing this. Tell us how you perceive that. Would this work well for you? How can we make it better? So really being intentional about creating our patients' experiences and taking their voice into account, because although we are very passionate people about creating a patient experience and wanting to do the right thing for our patients, we don't see the care system with the same lens. And so I always encourage people, when you're working on a project and you think, oh my gosh, I'm going to our patients are really going to love this. We're going to implement this and our patients are going to love it. Let's ask some patients up front so that we can make sure that our perception is the same as their perception. And that can only reduce frustration across the board, right? It can reduce the frustration of the patients who are experiencing something that, with all good intention, we implemented and then maybe miss the mark a little, right? And it's going to reduce the frustration of our staff members who are working on that and then maybe have to do some rework because we didn't, again, quite get it right. So that's my soapbox about incorporating the patient experience. And I think that the same is true for telehealth and AI. We need to be asking our patients about this, right? Do they even want us to use AI? How do they want us to use it? What would be helpful? What is the sort of attitude towards AI? And is it okay? So I think something that we would just really need to pay attention to as we move forward.
That's an interesting perspective for customer experience, period. Not just, right? It's like not just patient experience, but any customer experience would be.
Well, and the same problems apply, by the way. So when asked, we are saying something. And when it comes to, let's call it a test, lacking a better word, we are doing something totally else. And now the patient-provider interaction is something that is a bit more, let's say, in between private and intimate than a retail experience, for example. How can new approaches, new ideas be tested in a good way to prove that what I'm saying is actually what I mean and how I would do?
Yeah, I think it's really challenging to do that. And I think being fully transparent, right, with what we're testing and what we're doing. And there's a lot of research, research studies and things where people know what they're signing up for. And so maybe that's a way that we can incorporate these types of things. But again, being fully transparent, this is what we're doing. And we want your feedback along the way. And we want you to help us maybe co-design some of the work that we're doing with this to make sure that we're heading down a good path.
So it boils down to focus groups, basically.
Mm-hmm.
Right.
So with pre-announced testing, whereas again, there's a kind of a challenge with it, because at the moment I tell them this is a test, then I falsify the results, basically, because I create behavior just because of telling them that this is a test.
Yeah, and maybe it's not. Maybe it's the word test, right? Maybe we're piloting.
Pilot, experiment, whatever we are using, but this doesn't that create behavior?
I suppose it could, but I think that that's a good way to just being fully transparent and saying, we have to try that.
No disagreement here. No disagreement here. So I'm all about transparency. Well, no, not all about, but well, should be reasonable. But talking about transparency, there we are on privacy on the other side. There we are at the topic of the electronic health record. So, which is technically truly beneficial. but well, I'm a German, right? So I'm big on privacy with a capital B. So the next thing that the typical German thinks is, oh my God, my data is out in the wild and this is highly personal data. So how to deal with this? How do people work with this here in the US?
Yeah, I think that there are definitely people who feel that way here, right? But I think that there are also people who sort of like you assume when you go to
Mm,
the doctor that you're going to receive the best care and you assume you're going to receive the right treatment and the right care. I think that there is an assumption on some people's behalf that their data is secure and their data is private and it's not something that they
mm,
really want to worry about. Um, I think the most recent numbers are somewhere around 30% of um, Americans use, or patients use, the electronic health record and use those patient portals. So their data is in
mm,
there, but they're not accessing it, right? So it's not even the majority of people who are using um, the electronic health record. So I don't know if that speaks to the thought of, maybe this isn't secure. Um, but I know that also people tend to ask questions of chatbots because they're perceived as anonymous and confidential, right? Even though your phone tracks everything you do and your computer seems to know, your phone
my
knows
car too.
your phone knows what conversation about yesterday. Um, but people will use a chat bot when maybe they're asking a question about a sensitive topic
Mm,
that they don't necessarily want their doctor to know about, or, so I think that, there's varying degrees and varying levels of,
mm,
what people think about for privacy, but it's definitely a
mm,
concern. And we want to make sure that we're keeping everyone's data safe.
mm.
Yeah, no doubt.
When it comes to privacy, right, we also have communities. So now this is a really funny thing. So because as humans, we like to trust people like us. Um, means and then communities as such, especially online communities, are kind of anonymous as well because of, who knows whether the Thomas that talks in this community or writes in this community is actually the Thomas that there is, yeah? Or somebody totally else. Yeah? Yeah, what role shall these communities play there? Can they play there in this whole gamut of experiences?
Yeah, that's a great question. I think our online communities can certainly provide, again, the voice of the consumer, the voice of the patient to provide feedback to the
Mm,
healthcare system. Um, you know, I would say we're probably not hosting a lot of online communities for patients
mm,
to share information with each other. And I don't think we would do that. But I do see how those could be both helpful and harmful to
mm,
patients. I think you really want to make sure that if you're participating in an online community, that you trust uh,
mm,
information is accurate and that you're getting valid, good information, and not not something that is, again, going to be harmful to you as a patient.
Or make you panic. I have a friend who, uses my
yeah,
chart all the time, and her test results will come in before her doctor talks to her. And she'll look at her test results and she'll see something. She'll go, wait, what? And she'll go out to WebMD and she'll look it up. And then she'll find all of the discussion on it online. And, by the time she's 10
mm,
minutes in, she's pretty sure she's got something fatal and she's going to die from it. And her doctor will call her an hour later and say, yeah, you're good. This is a little bit elevated, but it's not really anything to worry about. Everybody has this problem.
mm.
She'll be like, oh,
Yeah, but there we are back to the communication topic, right?
right.
So there's factual information stated without context,
Absolutely.
and
Yeah.
and then probably in some geeky language.
Or, well, I think they call that medical terminology.
Yeah,
Well,
right.
or yeah, that, or maybe you see, a range presented to you, and you can see normal range is
Yeah,
X and
yeah,
I'm in
yeah.
Y. And so, yeah, I think that, we're required to present test results to our patients,
Mm,
and make sure that they have access to that. And I think that that's a great thing. But we do have to think about that. I had a personal experience a few years ago where I had a mammogram and I had to go back for further
mm,
testing, right? And what do you think I did? I logged into that patient portal every day to read the results or to find the results until they were posted. And yes, I knew the results before my doctor called me with the results, but I created such anxiety for myself. Um,
mm.
well, no, I had the anxiety of wondering what the test results were anyway.
Uh-oh,
Uh-oh.
we
Uh-oh.
lost her.
There she is gone.
Oh, no.
Yeah.
Well, it's definitely interesting, isn't it? Like how patient experience can be perceived, like the technology
Mm.
companies will think that they're helping patients because they're giving them the information right away. And then all
Very
of a
complex.
sudden, it's not quite so helpful.
No, I mean,
I've lost
the
you, so
sec,
just give me a minute, please.
yeah,
Yeah, sure.
it's
I
pretty
can't
much
hear
the
you
same also
anymore. Can you hear me?
yeah, we do. It's similar for the health information on food, right? So there is a dosage of something that is given, or the contents are given, but without any context. How much of your daily intake is that,
I'm
or
going to
of
leave and then I'm going to
the,
come right back in.
yeah,
Okay.
we're just covering right now. Or we are just covering right now. So that's without the context of how much of the daily intake of the average person this should be, it's quite meaningless, isn't it?
Yeah.
So okay,
Yeah,
it's
absolutely.
2 milligrams. So okay.
It was
Yeah.
interesting. I was having
Yeah.
a conversation with somebody last week, and he mentioned that he had to reschedule our meeting because he had gone to the doctor and he went for some routine radiology exam. And they
Mhm.
came out in the waiting room and pointed to him and said, you need to go to the ER immediately. Don't stop
Oops.
on the way. Please go.
Yeah.
And we're sending over your results right now. Go here. And so he went, and here, when they did this routine scan, they found a blood clot.
Mhm.
And it was apparently a pretty big one in his
Mhm.
leg, and they couldn't figure out why. He never had this problem before, and he said, "Well, I started taking," and I'm gonna mess up exactly what it was. He had started taking, vitamin D maybe,
Mhm.
and then he read somewhere where it said, "Well, without vitamin D, or with vitamin D, it doesn't really get absorbed unless you use vitamin K." And so he started
Mhm.
taking vitamin K. Well, vitamin K clots your blood. So
Well,
without
okay.
all of the context and all of the
Yeah.
information,
Yeah.
right? Shan's back. Can you hear us?
Sure.
I can hear you now. So sorry about that. I don't know what happened.
No.
Oh, technology, right?
That's
Yeah.
perfect example.
Yeah.
Let's use that to run healthcare.
Amazing.
Yeah, so better not using StreamYard for patient experiences.
Right. Right. So we were talking about experiences, and I just wanted to I wanted to kind of get to a point that we hadn't gotten to yet. And that was around patients owning their own experience. And Thomas, I
Mm,
know you were going to go here, but how much do the patients need to own of their own experience? And how do things like care and disease management and outreach, how much do they impact a patient's experience?
So we talk about the patient's experience from any interaction with the healthcare system, truly. I know a lot of
mm,
times people think about patient experience being just that clinical encounter, but we
mm,
really do view it as anything, anytime from the very beginning of interacting with the healthcare system to the very end of interacting with the healthcare system, right? And so that's those things, care management after appointments or through a disease can be really important, right? And help give trust and loyalty through the system, um, and help improve the patient's experiences. So we really have to take all of those things into account when we're planning and talking about patient experience. Now, how much should a patient own their experience? I think we put a lot on our patients, and I think it's probably too much sometimes. I think a lot of people who, if you're a relatively healthy person, maybe you go to the doctor once a year and that's it. You get some blood work done, and they say, great, see you next year, right? That's not a lot, but most people who have chronic conditions, they're coming in often, sometimes once a week, sometimes more than once a week. Trying to coordinate and arrange that care can be really burdensome, and they don't feel well, right? So in a time of great need, we're burdening our patients with managing their care. And so I think we put a lot on our patients, and it's probably too much. And I would love to be able to have a solution to that. Do I think AI and chatbots and other tech interventions are solutions to that? I'm not sure. I think that there's definitely some benefits to having those. There can be some help scheduling appointments. There can be some maybe medication reminders and things like that. But we put a lot on our patients. Now, when a patient comes in to meet with a physician, a very wise person once said, communication isn't 50-50. It's 100-100. I'm responsible for 100% of what I communicate to you and making sure that I understand what you communicate to me. And likewise, you are 100% responsible for communicating well to me and making sure that I understand and that you're hearing what I have to say as well. So from an actual communication standpoint, and when we're interacting with each other in the system, our patients hopefully feel empowered. And I know that there's evidence out there that says that they don't always, right? But they are the experts on themselves. And so we need to be able to take that into account and hopefully empower them to speak up and feel some semblance of control from that perspective in their healthcare.
Yeah, I know. When my mom was ill, one of the problems we had was managing her and her care. She didn't have any idea what was going on, and you would take her from one doctor to the next, and the next doctor would adjust the medication that she got from the first doctor. And then you go to the next appointment, and they adjust the adjustment, and then the next appointment adjusts the other adjustment. Then you go back to the primary care, and he's like, "Wait, what happened? This is nothing like you left here with." And I think, you can own your own experience to an extent, but man, it would be helpful if some of these things talk to each other.
Yeah.
This is probably a good context for another question from Stephen, one of our most avid watchers, most active watchers, actually. So how did that change over the years? The experience that I receive or that is offered to me, which is another topic altogether.
So the experience
how did it, well,
things like
I would say how did the engagement change? The experience lies within me, but how did the whole interaction change in the past years?
Yeah, I mean, I think most of my healthcare experience is throughout the pandemic. And so I'm, navigating some of these changes myself as well and watching the changes with great interest. Drawing on my childhood and growing up, right? We had one primary care physician. We didn't have large healthcare systems like we do now that are growing and expanding and becoming more and more complex. And we really had a relationship with our physicians. So my mom could call in and say, we have a sore throat and a headache and we're vomiting. And they would just say, oh yeah, we're going to write you a prescription for, it sounds like strep throat, we're writing you a prescription, right? That has really changed these days. And the complexity of healthcare has also changed. So there may still be some private physician offices out there that have those relationships and do that with their patients. And they're so convenient and family focused. And and friendly and great patient experience. And then we have our big healthcare systems that are, again, they're just very complex. And so you don't always know what number to call to make an appointment. It's not always one number. It could be a couple of different numbers. And, you know, it can be really challenging. So I think the growth and the expansion has definitely had an impact on our patients' experiences and how they, you know, can navigate their care.
How did this complexity get created? Sounds like you would advocate for making it simpler again.
Well,
we didn't wear seatbelts either, Shanne. I'm just saying.
You know what I would really love to see, and I think in an ideal world, we have these large institutions that have a lot of expertise, right? And they have the cutting edge technology and they can provide the best of clinical care. But then we have that small feel in building relationships. So I'd like to have some type of merging of these two worlds where we have the feel of a small town, personalized physician who knows me well and knows what I want and knows what's important to me, and also the cutting edge technology and all the expertise of some of these larger healthcare systems. How did we get there? I don't really know, but that's what I would like to see. That might be a pipe dream, but you know, I can dream. It's okay.
Well, we all somewhat dream, but the reality is, it was the start of the lead up and a comment that just came in again. So there's no really clear pricing. We have mundane things like invoicing going haywire. There's the insurer, there's the provider, there's the patient, and as a patient, I get something called statement, which is not exactly an invoice, which comes from the insurer that there may or may not be something unpaid for, some service. Then I get an invoice from the provider that actually should go to the insurer, which I need to provide when visiting. And I don't even know what I've paid for and what not. And they don't seem to have this insight either. So which goes on to the very mundane parts of my experience, which basically annoys the hell out of me.
And we can say that, you know, we tried to get a payer to come on to talk about payer experience, and I couldn't get anybody to agree to do it. So if you are watching this and you are with a healthcare insurance company of any kind and you'd like to come on to speak to the payer experience, we would love to have your perspective on this show.
Yeah, very, very good. Which probably, looking at the time, I mean, we had the fear that we are covering stuff too fast, which we
Not
aren't.
Today.
which we aren't. So that's what is as a hookup. So there seems to be some interoperability issues, process interoperability, or maybe just IT interoperability. So what do you think should get technically or could get technologically enhanced to improve systems so that I am engaged in a way that I have a positive experience, or that the negative ones are avoided? The negative ones under their control are avoided.
Yeah, I think it would be great to figure out how to have like a one-stop shop for our patients. That would be amazing, right? So as one example, right, if you are using the patient portal from the electronic health record, and maybe you check in for your appointment through that portal, but then you arrive in your clinic and you still have to check in again, right? And you're like, why do I have to do this? I checked in on my phone, right? And maybe they do talk to each other, just maybe it's not quite all of the information or something like that. But I think that there's a lot of opportunity to have all of these things talk to each other. And if you're engaging the patient through either an app or through the patient portal, you know, letting the patient put information in there about what's important to them, or maybe updating my own height and weight would be okay, so that my doctor can see it, then can push me out some messages, although I probably wouldn't want to see those messages. But what can we allow our patients to input into the system that can help inform their care, and maybe help them to be a little bit more engaged, but also help us keep people healthy, right? Because that should be the ultimate goal of the healthcare system, right? Is to keep people healthy and to treat them when they are not. And so how can we use, and that technology's, the technology's out there. I think it just takes somebody who's going to have to hook it all up for us.
Okay, that have been some perfect famous last words. Thanks a lot, Shanne. So this was amazing because our time is up. we are not out of topics, but out of time. So it means we need to repeat this at one day. So, and be assured you perfectly survived the hot seat.
Thank you for having me.
I don't think that you feel even burned. So
maybe.
Yeah.
No.
Okay. So to our audience, if you think you have what it takes to perform as well as Shanne, then let us know. We'll put you into the seat, and we really love to hear from you. That's it for today. Thanks a lot for being with us. Thanks a lot to Shanne and the audience. And let's see next week. I'm Thomas Wieberneit.
And I'm Kristy Tupper. Tune in next time for different faces, different topics, and different perspectives as we put somebody different in the hot seat.